Egypt has achieved significant progress in reaching the Millennium Development Goals 4 and 5 of reducing maternal and child mortality. However, neonatal mortality, which is the probability of dying in the first 28 days of life, remains a challenge. In order to support the achievement of the 2030 Sustainable Development Goal target to end preventable child death and reduce neonatal mortality to at least as low as 12 per 1,000 live births, we need to ensure that all newborns are put to the breast within the first hour of life. Ladies and gentlemen, breastfeeding is the cornerstone to child survival, ranking one of the top 10 most effective nutrition interventions for the reduction of under 5 child mortality. Breastfeeding is also known to reduce risks of non-communicable diseases in early childhood, including obesity and diabetes. Exclusive breastfeeding facilitates interaction and bonding between mother and baby at a critical moment in early brain development through the right nourishment and positive stimulation and care. Yet, it is sad to see that the exclusive breastfeeding rates are declining globally, as well as in Egypt. As highlighted in the global Yunifef publication from the first hour of life released this week, less than half of all newborns are put to the breast within an hour of birth globally. That leaves 77 million newborns globally waiting too long for this first critical contact with their mother. In Egypt, only 27% of infants are put to the breast within the first hour, with insignificant wealth or geographical variation, indicating that all communities are in need for support. The revival of the baby-friendly hospital initiative ensures that every newborn receives appropriate care and every mother is empowered to breastfeed immediately after delivery. This initiative of national importance has measurable and proven impact in increasing the rates of exclusive breastfeeding for the first 6 months of a baby's life. In 2008, the Lancet series on maternal and child nutrition presented evidence to quantify the impacts of child malnutrition. The series was the first to shed light on the first 1,000 days of a child's life, as the critical window of opportunity where malnutrition preventative actions would be most effective for a child's survival. While breastfeeding is a personal relationship between mother and baby, it is not a one-woman job. It requires a wider network of support and enabling environment through policy and legislation, from families, communities, workplaces, and the health system, as well as government leadership to really make it work. UNICEF is committed to combine its expertise and resource with those of the Ministry of Health and Population and other partners to accelerate effort to make this happen. We are working with the National Population Council to strengthen community awareness and support, as well as develop the National Nutrition Communication Strategy to support all national efforts for nutrition awareness. In addition, UNICEF has developed with the Ministry of Health and Population a conceptual framework for the first 1,000 days, aiming at strengthening of infant and young child feeding practices.